Okay, stress, cardiovascular, and return to work. Stay with me on this one. I know it's going to be very pertinent to a lot of things you're doing. So if you've been through my talks before, you know I have to go through some of the disclaimers and disclosures. I'm required by that process through the state bar. And so I'm just going to kind of go through those relatively briefly for you about the things that I did or did not say. So I did not say what you thought I said. You did not hear what you thought you heard. Any statement is my error, not my coworkers. And by the way, I'm not a victim. And I find it ironic the colors red, white, and blue stand for freedom, unless they're flashing behind you. I put that in for you guys because of all the police and fire that you have going on there. The books, as a lot of you know, I wrote some of the books for the AMA, so I'm required to show them to you because if you buy one of the books, then we do get royalties from it. Trust me, it's not a lot of royalties, so I'm definitely keeping my day job. But nonetheless, full disclosure, the causation book, we will talk about some of the principles here on causation today. This talk also talks about return to work, and so this comes from the return to work book that we wrote. The 6th edition of the AMA Guides, I know we're a 5th edition state, but in the 6th edition of the AMA Guides, don't forget that you can use any reference. You can use any reference in medicine to justify your opinion or ask questions about an opinion. And that includes using a more updated version of the AMA Guides. At times, that could be helpful. At times, that might be viewed as not helpful, depending on the case. So just to let you know, it is a viable alternative of information that you can consult if you're interested in some aspects of a particular claim. If you have anybody that's relatively new to disability benefit systems, this is a book that's very helpful. It goes through a lot of the principles and concepts and summarizes it in a very short period of time for people. And so if you have someone that's interested in this kind of world, it has the return to work, causation, some of the other principles summarized in more brief chapters. I do get paid by the MD guidelines, which is a disability duration guidelines. And just to let you know how charitable I am, a man recently knocked on my door, asked for a small donation towards the local swimming pool. So I gave him a glass of water. Okay, and then here's the boys from a few years ago, and they've gotten much bigger, as you'll see later. But that's also who I have to thank for everything. Okay, so what are we going to cover? Stress, cardiovascular disease, stress in the work environment, a little bit of tips to treat stress, and then the return to work principles. Kind of put them in together. Okay, when you're talking about stress and cardiovascular disease, there is medical literature that talks about this. But you have to understand that this literature overlaps with a lot of different areas. One of the things I'd like to point out is that Barsky has some good data out of Harvard that patients will say that they're having symptoms and you will not be able to uncover any abnormalities. That is normal. It's not to say that when a client says to you, look, I'm having palpitations in my chest, I'm feeling something in my chest, it's not to say that they should not have a workup, that they should not be pursued and should not be looked at. But don't be surprised if some of those tests come back and say, we don't find anything, because that is medically likely to occur in some of these folks. And that's been shown in the literature, okay? Limitations when you look at stress. So what happens is a lot of these studies are retrospective. So it's you're saying to somebody, okay, at this point in time, were you ever stressed in your life? Okay, well, of course, now you're going to have this recall bias and things that can be sometimes hard to sort through. That's why when sometimes I ask questions about stress, some of these people can't recall all their experiences. It's been going on for many years. They don't have at their fingertips things that they can remember. Well, listen, it's no different. If I were to ask some of you the same thing, hey, do you remember when you had the surgery? Do you remember when you had the stress or something? Okay, sometimes people can say, okay, I remember when I got divorced or something, a bigger thing like that. But a lot of little things will not be apparent, which is why there can be difficulties in that literature about figuring out what might be operating. Just remember, women sometimes make fool of men, but most guys are the do-it-yourself type, so we're quite capable of making fools of ourselves all the time. There have been descriptions of major events. So pertinent to you and I, Northridge. What happened? You had that cardiac event go up from the earthquake. You had about 16 deaths per day. And what happened was it went up to about 51 deaths per day. just from having an earthquake, right? Because what happens is there's clearly something operating when we're under some type of stress, and it can hit us in those times that we don't expect it. Taiwan had an earthquake, same thing. Heart rate variability means that somebody was actually experiencing some change in the rhythm of the heart, and there is medical literature that says that if you have heart rate variability, you are starting to have an increased risk of trouble, right? Okay, next. General reports of stress. So look at this, look at the study, right? The Inner Heart Study, 52 countries. And what does it boil down to? What are the 9 conditions that are going to give you a feeling of what could be operating for somebody? So look, lipids you've heard about, smoking, hypertension, diabetes, right? Obesity, we got, okay, look right in the middle there. Psychosocial factors, right? It does influence these risks. This is not to be brushed aside saying, oh, well, you know, you're a little stressed, everybody's a little stressed, get on with it, you know, muscle up, you know, whatever. It's not true. There is data for this. By the way, there's also data that if you're a caregiver for an elderly parent, that actually puts you at risk for cardiovascular disease. Not to say you shouldn't do it, but there's data for that. Anxiety and risk is seen. Silent myocardial ischemia is seen in a lot of situations, and that's where patients will not have chest pain. They will not have symptoms. But when you study them carefully and they say, look, I was under stress, there is ways to document that things are operating there. Depression and risk of sudden cardiac death. Now look, in our world, the Nurses Health Study is one of the most important studies we have. They have done exceptional work at following a huge cohort of nurses over many years. And look, women had 1.5 to 3 times the risk of heart disease if there was risks of depression, right? So this is important. It is real. By the way, there's literature, by the way, that says that doctors have had a tendency, I believe I don't do that, but nonetheless, I have to be honest, doctors have a tendency that when women complain of chest pain, shortness of breath, limitations in activities, doctors are less likely to consider cardiovascular causes in women, okay? Trauma, PTSD. Well, there's literature on that, that if you have evidence of trauma, now a lot of this comes from the military, but nonetheless, that is applicable to some of the patient population that you're dealing with, that there is a risk of cardiovascular disease. And you can see some of the data here about how often that occurs, right? There was a prospective study on PTSD and coronary disease in women. Again, look at that. The odds ratio, 3.2, not too different from the Nurses Health Study, which would make us believe that it is a true number, right? And there are these studies which do support it. Now, when you talk about stress, you may have heard of this entity, so I want you to hear it clearly. Takusobo, okay? This is a specific kind of heart change. This is not coronary artery disease. This is where the heart changes its appearance, its shape, and you will have changes of troponins, which is that blood test that measures the heart. And this is generally reversible, but it depends on the individual. It depends on the level of conditioning. It depends when they had it before. Those are the things that are operating there, okay? All right, what's the mechanism? How is this possible? What's going on? What happens when somebody says, I'm stressed, right? What could be causing this stuff, right? So there is one theory that when you're depressed, when you're anxious, when you're happy, you have poor health behaviors. How many of you have been stressed out from work, stressed out from home, stressed out from a kid, something's going on, and you say, screw it, I'm not going to exercise, who cares what I eat, I'm going to drink a little bit more? That's one of the mechanisms that psychological factors can hit you on the cardiovascular, right? And that's been seen in a number of studies, right? Another one, increase in cytokines. Those are some of those transmitters that go up. When you're stressed, your heart rate can go up, your blood pressure can go up. You can start having irregularities on the EKG, the electrical signals, right? Catecholamines, right? That flight or fight stuff, that's also going up. And there are studies that show in the long term that if you have a history of mood disorders, that over the years, you're going to have a greater risk of having these particular difficulties. This is real. It happens. Okay. All right. Rest up. I got to be different. They're all looking the same. Okay. Anyways, so what I want to talk about is types of stress. Okay. So when we talk about stress, there's two types, right? Acute and chronic. Acute, sudden, severe, significant. This is the one that's usually very easy to identify in your claims. The person was in a situation of confrontation, a bad phone call, a heavy lifting exercise. Something's going on, acute, sudden, severe. It precipitates that blood pressure, that arrhythmia, that infarction. That is usually fairly clear causation, right? Chronic stress. When you're saying chronic, you have to describe it as any risk factor. Well, like all the risk factors we know, it has to be present on a relatively constant daily basis if you're trying to figure out, did that have an impact, right? So look, I put the examples. You don't smoke one cigarette, have trouble. You don't have ultralipids one day and have atherosclerosis next. This builds up over time. So therefore, one of the questions is going to be, how long was this person working, right? What was their job? And when you deal primarily with municipal employees, they tend to have very long work histories. That's why the chronic stress is applicable in a lot of the public safety people because of length of time, right? Now, this is an area of a lot of research. There's a lot of different ones that look at this, right? So one of the original ones was Karasek's job strain model. So what he did is he said, well, this is a combination of low decision latitude, high psychological demand, right? So think about that, low decision latitude, high psychological demand. Put it together in a questionnaire, and this is the data you get. So now look, don't freak out of this. Just follow me with it. Follow, right? Look, on this axis here, decision latitude. So the greater your decision latitude, the less of a job is going to impact you, right? Look at the other, psychological demands, meaning you have to work faster. You have less time available. You have to multitask. There's a lot of constriction in how much control you have over your time. Well, as you start going up that scale, that's going to put you at risk. So who's the risk group, right? So look. You got low decision latitude, high psychological demands. That's the high strain group. And you see that the firefighters fit into that group, okay? Because they have those types of requirements of their job position. In his original data set, that was what was going on as far as being able to identify people that are clearly at risk by the nature of their job, okay? And in that model, that's how we come to those decisions about who's at risk. Now look, there's others. Look at this, Seegers-Haddard effort reward model. And here it's a product of high job effort with low social reward. Okay, now I'm going to say this again because of the group I'm speaking to. Can you think of a job that has high job effort with low social reward, where people will say, oh, you guys don't do much for society and we don't like you very much despite all your efforts, right? Okay, that to me sounds very much like my legal colleagues, right? So this is a risk group for heart trouble, right? And there are other models that look at this in other literature, and there's even questionnaires that you can give people that allow them to document this, okay? All right. The secret of our success is we hire good people. What are you saying? I'm good. I've never heard a compliment. Is this self-esteem? He's awkward. Just ignore him. Behold goodness. Everybody has their ideas of what's goodness. Karen Belchick. She's a clinician, a colleague of mine that I've met with, and she had one. And in her data sets, the increased risk was in commercial bus drivers, right? Municipal, commercial bus drivers were at risk. Another one, Alfred said, this is very important, very important. Look. Shift work. Okay, I'm saying that word as clearly as I can for you. Shift work is associated with risk, right? And so that's very applicable to your patient population that you're seeing. This is a direct predictor of people that are going to have cardiovascular difficulties, right? And by the way, look at this. If you work more than 46 hours a week, it starts to put you at risk. Okay, so I want you to hear that, right? If you start working more than 46 hours a week, you're starting to put yourself a little bit at risk. By the way, tell you something. By the way, if you say to me, well, you know, Mark, it was just a long day, a hard day, I had to work late and stuff, and then you work till 10 o'clock, right? And then you're back in the office at 8 o'clock. There's data that if you don't give yourself at least a 12-hour break from night to morning, that you're putting yourself at some increased risk, okay? So how many of your clients do you know that are being pulled in at various times to meet staffing requirements, right? So keep that in mind, okay? So type A leaders may handle it better, but it all depends on the individual, and there are impacts from the environment that do that, right? So remember, job demands are what the physical, psychological components are, and resources. What's your personality? What's the organization? Do they support you? Are you in a work environment? Is your municipality well run? Do they understand their employees? Do they work with their employees? That's going to dictate what's going to be their experience from that, okay? Canadian study with 60 years of follow-up suggests that women with work stress in high physically demanding jobs were at increased risk. And again, high decision latitude helps, leisure time activity helps, right? Okay, employee schedules. Ammonia, bleach is toxic. Carlos and Tony together hide the knives. Judy and Romeo get the hose. There's ways that people interact with the work environment that makes a difference, right? And it goes into how cynical you can get, what type of job strain it leads to. And so it's probably best thought of this time, urgency, and patience. Got to work faster, got to work quicker, got to get a lot done. And then what type of personality you have, how you handle that stress, and don't overestimate that this is a nothing, right? This is a something. There is good studies that show that when you have this stress, there are clear impacts on your blood pressure. There's clear impacts on yourself, right? And so there's stress tests. This is from Wall Street Journal. You know, go fill it out. You want to test yourself? Take this test and say, do I think I score high on a stress test, right? And you can look at the numbers and decide for yourself whether or not you think you're handling yourself well, right? Okay, rest stop. So here you go. Alcoholics Anonymous, abused spouses, and America's joyous future. All right, so what can you do about it? What can you do about the stress, right? So, because I'm, treating my patients, right? I always like to talk about what you can do. All right, so what you can do to help yourself. Exercise, exercise, exercise. Can't say it enough. Even if it's just playing baseball. Okay, it's good. Stress reduction techniques, biofeedback helps. Hibiscus tea. So if you want to go to Hawaii and get some hibiscus tea, blueberries help you. Getting a pet actually helps you reduce stress. Volunteering, getting outside your head. There's good data that will help protect you from heart troubles. Get or stay married. There is data about being in stable relationships, which can be very helpful. Again, it's got to be a healthy, stable relationship, but that can be very helpful. Having a kid, if you have a kid, it seems to blow off hours. And then here's that 14 hours between shift work really helps to try to think about that. And also, prayer never hurts. That's the stairway to heaven. And you can always use something to get you along. Exercise. Remember to look both ways before crossing the desert. Moses' mom has to say to him, so get lots of exercise crossing deserts and you'll take care of your stress. My wife has started her own business. I'm sorry to hear that. How many years have you been married? She's not leaving me. She's starting a business. Right. Don't talk about phase 2. So always staying married can be helpful. And Noah, keeping an eye out for my mother. She's coming with us. And so time's up on that. When you look at fitness in the United States, look at this, look. You can see that it's been worked out by different locations. So you get those nice deep blues where we are. That's very protective, and that's going to help prevent you from getting into trouble with your stress, right? So please keep that in mind. Remember, I'm too blessed to be stressed, too anointed to be disappointed. Actually, you had a pretty good life, but you were looking down at your phone and you missed it. So that's something. Stay off your phones, folks, because that's not good for the stress. Okay. All right. Now, we've talked about stress. We've talked about the studies in the literature, right? We talked about what you can do about the stress. How does it impact your work? Okay. So when we're doing return to work, I want you to keep in mind 3 important concepts, right? Capacity, risk, tolerance. Capacity, risk, tolerance, right? Capacity. It's the physical ability to do things. Risk. What's the chance that if you do those things, you're going to hurt yourself again? And tolerance. What are you willing to do, right? So we all know that there's people that will say that, you know what, this is my job. This is what I could do. Stresses me out. I'm able to do it. Maybe I'm putting myself at risk, but I'm willing to tolerate it for the benefits that it gives me. Either my ego's tied into my job title, my identity's tied up with that, I have to support my family. One of those things could be operating. So for a patient, their number one issue is usually going to be tolerance, right? What they've decided is what's going to be operating. For a physician tends to think of capacity first, right? And not risk. So that's why you can have a discrepancy between what somebody's telling you and what you might be seeing in a report. So keep those terms in mind when you're looking at that. Somebody could say to you, look, I can't do this job anymore, right? And a physician may come back and say, well, I tested him, it seems fine, right? And it looks like risk-wise, he could tolerate it. So it really becomes an issue of tolerance. That's why there could be a discrepancy. But mind you, I've put that in my report sometimes. And in particular, when I'm dealing with public safety, if somebody is not able to tolerate it, that's a critical issue because these are safety sensitive jobs. By the way, I want you to know, I have the same discussion with colleagues of mine. If I have a physician that starts to say to me, you know, Mark, I don't know, I'm not that into it anymore. So that I said, retire right now. Because could they do it? Yes. But if they're not willing to tolerate it, they're more likely to make mistakes. And that's trouble, right? So that's one of the issues that has to be thought about when we talk about risk, capacity, and tolerance, okay? I've got a note from doctors that not carry more than 10 times my weight. Capacity can be helpful. Leaving at 7, all my work is done, then get more work. That would make my life an exercise and facility. Exercise is good for you. Well, the perspective is, from a heart doctor and internist like me, exercise is good. My patients say, Mark, you keep telling me about exercise. You must care for me. You're a good doctor. But sometimes when they get the same information from an OC doc and the doc says exercise is good, the patient says, well, that hurts. You're a bad doctor, right? But that's not necessarily the case. The capacity, your abilities will be dictated by what you're willing to do and what exercise you do for yourself to help yourself, okay? What puts you at risk? So when you look at cardiovascular risk, there are a lot of things that we talk about, but there are occupations that have been already identified as putting somebody at increased risk, right? So we talked about those other ones, right? You've all heard about hypertension, diabetes, LDL, but look at this list. Look at these different groups that have already been decided puts you at risk for cardiovascular troubles, right? Irregular heartbeats. You can also get in trouble from cold preparations, weight loss products, herbal preparations. I got a lot of this where people are taking things from over the counter, but it can have an impact that you need to know about, right? Keep that in mind, right? from the former guidelines, you may remember some of this verbiage, right? So this kind of verbiage was the kind of verbiage that makes sense when you're looking at risk of work, right? And sometimes I go through a whole battery of questions about risk, about return to work, about what somebody noticed at the work environment. These are the kind of questions that you might want to see in a report to help you understand what's operating for the risk, right? And then finally, tolerance, right? So first of all, always I talk to people about that work is good. There is a lot of data, not a little, a lot of data that says when you take somebody out of work, their markers of mortality all go up. Depression, suicide, drug use, divorce, marital violence, child abuse, all those markers get worse. So make sure that when somebody's ready, it's the right person, the right time, right? That's why that if I have somebody that's younger or somebody I think has a further career ahead of them, I'm very biased to try to figure out ways to get them back to work, because I know that if I don't, I'm now sealing a deal that they're going to be at increased risk for future medical troubles and complications. And that's why it's very important to try to keep people in the work environment when it's the right person. But if they get to those older years, if they're no longer able to tolerate it, especially in public safety, that's where some of those warnings start to happen. That's it. Okay, here's 3 of the boys when they got a little bit older. So you see they got a little bit bigger.